According to the latest Resuscitation Council guidelines, if you've been trained in adult CPR only and you're faced with a child or an infant in cardiac arrest, you should use the adult basic life support sequence if you do not have special training in paediatric resuscitation. It's far better to perform adult CPR than do nothing. In other words, adult CPR is acceptable and effective for children and infants if that's all you've been trained to do. If a child or an infant is unresponsive and not breathing normally, you should ensure the scene is safe, look around for any dangers to yourself or the child. Check responsiveness. Gently tap the child's shoulder or the sole of a foot for an infant and ask loudly, "Are you okay?" Shout for help. Ask someone to call 999 and put their phone on speakerphone and bring an AED if one's available. If you're alone, use your mobile phone on speakerphone and the operator will guide you through what to do. Check for normal breathing. Look, listen and feel for no more than 10 seconds. If the child is not breathing normally, start CPR immediately. If you're trained only in adult CPR, you should follow these adult-style steps for the child. First, deliver 5 breaths, the same as for adults. With an infant classified as under 1 year old, do not overextend the neck and seal your mouth over the infant's mouth and nose. Place the heel of one hand in the center of the chest. For older children, you may need to place 2 hands, and for infants, use 2 thumbs. Press the chest down 1/3 of its depth. Compress at a rate of 100 to 120 per minute, which is about 2 a second. Allow full recoil after each compression to allow the heart to refill with blood. Deliver 30 compressions followed by 2 breaths and continue until the child breathes normally, help arrives, or you're too exhausted to continue. If an AED arrives, switch it on immediately and follow the voice prompts. Use paediatric pads if available or adult pads if not. Place one on the chest and one on the back. If the child is under 25 kilos, place the front pad slightly to the child's left side. The Resuscitation Council emphasised that children usually suffer cardiac arrest due to a breathing problem, so giving breaths can make a big difference. However, any CPR is better than no CPR. If you only know the adult sequence, use that. The small differences in depth, rate and ratio are far less important than starting quickly. And finally, early chest compressions and defibrillation significantly improve survival rates.